So we're going to go over the basic science for PRP, go over some of the regulatory aspects, discuss what's in PRP and BMAC, and then how to dose them correctly, big topic nowadays, and then go over some of the differences between the two. So we use PRP, because peripheral blood is easy to access, plentiful, and it contains 3 elements that are critical in tissue healing, right? So you get your platelets, of course, and we got white blood cells and then plasma proteins. And these are all going to be essential in the healing process. So